had an elective procedure done when my youngest daughter was 5 months old. And I was prescribed 72 Percocets at that point. And I took that first one. And it was actually 2 prescriptions. It was accidental. So the first one was, what's half of 72? 36 of them. And another provider sent another one on accident. And I didn't know that until I finished that first 36 pills. And I'm like on my Walgreens app and I'm like, there's another one. So I filled that one. And so I took all 72 Percocets. And I think you mentioned before, like the same feeling, just all this stress and weight just fell off. You know, I felt like it fixed me. I was chaos feeling, and I don't know if I went into all of that, but just the anxiety that I was feeling after internalizing a lot and just, you know, not seeing a therapist. I have really bad anxiety as it is. So, you know, adding the stress of maintaining a home, you know, we had bought our first home right before I got pregnant with my first daughter. So we didn't exactly adjust to owning a home that we need to maintain. And then, having 2 kids, like throwing that in the mix. And my mother's death and then COVID. So I just felt like this is amazing. This is like what I used to feel like is how it felt. And I didn't think of that as a problem at the time. And I don't know why. I don't know if it's, you know, addiction will convince you. They are known to do that clearly. So I was like, it's not a problem. What if I just, the rest of my life, I find a way to take a few of these? I will be cured. Like I'm going to be myself again. Like this is great. So I went back to work after this procedure and after I ran out of those Percocets, and we only had IV fentanyl and Dilaudid, and we kept it in this back like cabinet
at the medical center you're working at.
Yes. Okay. Yes. So this is not labor and delivery.
Yep.
So anyone who, you know, works in the medical field, it was not a Pyxis, it was a cabinet. And there were 3 nurses at this particular facility. I was the person who came in to open the place, and I was responsible for moving IV medications from that cabinet. But there were boxes of like 25. I mean, it was a full stockpile of IV meds, and I would move them to our daily stock, which is like a basket. And the daily stock were the medications that we gave to patients. So I look at this back stock and I'm like, and I remember that day, like it was yesterday, where I'm like, if I open one of these boxes back here and I take a vial and I bring it home and I just give myself like, you know, I can mix it with saline, just do like just such a small amount. Cause I was scared, you know, I'm like, what if I overdose myself? And the beauty was that I knew how much it was, and I knew how to do IVs. And I mean, at that moment, I abused my position that I had by doing that, because obviously I made the choice to put one in my purse. And I remember just like that back and forth that I had that entire day at work. And I convinced myself that, well, there are other people who've diverted before. We don't really know what happens to them, but what's the worst that's going to happen? I'll just get fired. You know, that's the worst. I didn't think of it the way that I think about drinking and driving. It just didn't, I don't know why I didn't, because I should have. And that's what kind of propels me. One of the reasons speaking out at nursing schools and speaking wherever I can, because I firmly think had I heard a story like this, I think I at least would have gone back to that moment in nursing school, hearing that story. And I don't know for sure, but I think maybe I wouldn't have done it. Maybe, I don't know, but I did it. And I waited till my family was sleeping, and I drew up like a really small amount, and I did it. And it felt like the Percocet, but it was immediate and better. And I kept doing it. I would take from that backstock area, bring them home, and I thought that I was going to quit every single time I did it. I would say like, this is the last time, like never again. I'm not addicted. It was an experiment to me every single time. It wasn't a problem. It was just something, a little mistake that I can fix. And I got really sloppy with my charting. And that's not because I was high while working, because I would wait, at least at that point. I did this for 4 months, and I don't want to share too much, but I wasn't doing it on the job, but I was leaving early. I was the first one out the door so I could get home and do drugs. And I would take them for the weekend. The weekends were like my time to do it. So yeah, I got sloppy with charting to cover up for my theft. And I think it just became like my focus. If my kids were sick, I was making sure I could still work. My husband was having to sacrifice his job so I could make sure I got what I wanted from work. And so, yeah, I was caught due to forging a legal document, a doctor's document, to make up for my theft. Do you want me to go into detail about?
Yeah. How did you, well, first off, were you refilling those with saline?
No.
So
I did though at the end.
You were just taking them from the back stock, and the back stock, they don't do inventory on?
They do not open. So they wouldn't open the boxes to make sure that they were full. They would see. So for example, we would have 4 or 5 boxes of 25 vials of fentanyl.
Okay.
I don't remember the dose, but yeah. And I would cut a hole into the side. So there was a plastic wrap over, the box. And this has been very helpful for hospitals that I've been talking to, like the pharmacy staff, because what I did was very sneaky. And I would take a vial out and that box would be missing, 5 vials. And then I would forge documentation. And that's why I have been able to, I can confidently say that no patient suffered in pain. The possibility was there. Had I been doing this for a year, I don't know what I would have done. But at least during my addiction, I would say that a patient was in pain when they weren't. And most of our patients weren't in pain. They just got out of surgery. They would wake up and then they're, out the door after an hour or so. And I would just chart, because I was also the recovery nurse, and I would chart that a patient needed pain medication when they didn't. And then I would take it from that daily stock and I would slowly replace them. So I had this whole like juggling act going on. So the week that I was fired and I forged that document, I had this story. It's such a weird story, but it's the truth. So I had a wedding to go to. I was going to be in my friend's wedding, and we were going to Cabo, Mexico. And so the week prior, there was 1 box of Dilaudid left in that back stock. It was missing half of those vials. There were 5 vials just missing. Nobody had opened it. I thought that I couldn't order the new medications, which is probably a good thing. So I had to wait for a provider to order new ones. And I kept asking, I tried to be subtle. I'm like, did you order more? Did you order more Dilaudid? And they didn't order any. And I kind of started to panic. I was going to be gone the whole next week. So I'm like, they're going to have to open this box next week. They are going to see that half of these vials are missing. It was 5 out of 10 of them. And so I start panicking like real bad. And my daughter, the same week she had RSV. So I had to miss 1 day of work that same week. And so at this point I have like 2 days left that I need to figure out a way to cover up for these and forge documentation. So I panicked and I forged I don't want to give too much detail, a full document saying that somebody received like a lethal dose of a medication. And my plan was to replace, those with the daily stock, if that makes sense, so that I can go on my trip and that box looks full. And they found the original document. Somebody did. And I think I just put it in the trash. The original one saying that they hadn't gotten, I hope this makes sense.
Mm-hmm.
So somebody found it and then they pulled up the chart and they saw mine and they're like, wait, did you do this? And I forged a doctor's signature and everything. And I was like, oh, I lost it. So I just redid the whole document because I was nervous to ask the doctor to redo it. So I just did it myself. And that same day or actually it was the next day I was fired. But so I go home that night that they discovered this document and I made a plan that I was going to cancel my trip. And this is when the refilling took place. I grabbed empty vials and I had a lot of empty vials and lids in the back. I had a spot in my husband and I's bathroom, like in a cabinet. And it's just looking back, I'm like, I can't believe I got to this point. But yeah, I pulled a couple vials of Dilaudid that were empty that I had used. And I grabbed the lids, any lids. And the next morning on my way to work, I stop there's a gas station very close to this facility. And I stopped there and I'm like, do you have any super glue? And they had to like go to the back and they got super glue. I bought it. I go into the facility and I filled 5 vials with saline and I glue the lids on them. They were so sloppy. They were horribly done. And I put them into that back stock and I put them into that box back there, into that stock so that that box would appear full. Cause I'm like, okay, they've got to be on to me. So I'm going to cancel my trip, which I did. I texted my husband, my mother-in-law, and I'm like, okay, I'll explain later, but we cannot go on this trip. I need to work. I'll explain why later. Nobody knew about my addiction at this point, So my husband's like, okay. And I volunteer to work the following day and the whole following week. I told my coworkers that my trip was canceled. And I'm like, I can come in and work tomorrow. Like, I just really want to work. And this was like my last ditch effort. And my plan was to work and replace those 5 saline vials. I just wanted that box to look full in the meantime. So I did that. I put them into that back stock. I worked that full day. At the end of the day, I was terminated. My, employer sat me down in her office and she's like, after you forged this documentation, she's like, I have to let you go. And I was in such denial that I didn't think that I would be fired for that because I think my addiction, I was just so deep in, I was in complete shock. So after I'm fired, I go to that backstock cabinet and I grab those vials. I accidentally left one of them, but I grabbed the 4 vials and I'm like to my coworkers, I'm like, look, our stock is going to be short some vials. I'm just letting you know. I'll explain later. And I just left. And my employer called me and had no idea what was going on. I think they thought that I had taken more, taken actual drugs, not the saline filled ones. Mm-hmm. So I came back after she called me and they asked if I could return what I had taken. So I returned them to my employer and I said, those are filled with saline. I'm just letting you know. And I didn't fully explain the whole story of what happened. I just said, I have an addiction problem. And it took me like 20 minutes for me to finally admit that I had an addiction problem. And I mean, I felt really relieved once I did, when I did tell them, but I was so like ashamed of myself. But, the feeling of just knowing like it's over now, like it's over. I don't have to live like this anymore. I think I wanted to stop the whole time. And I don't know, just the thought of had it gone on for another year, I truly think I would be dead. I would have, it was progressing like so rapidly. So those saline filled vials were turned over to the FDA. So the FDA investigates these things. And I didn't know any of that. And so while the investigation was going on, they have to test these vials. The FDA has like a lab and they tested those vials. That takes apparently almost a year for them to test them and get all their evidence together. Because this is, extremely dangerous if patients would have received those. And there are situations where patients have died because people have refilled. There was somebody in Jacksonville. He did that for a long time. He did the refilling with saline, and patients were receiving those. He took the drugs and they received them. And he ended up transmitting hepatitis C, and one patient died. So he was sentenced to 30 years in federal prison.
30?
So they don't mess with, they don't play with that, which they shouldn't. And so, I was arrested by the state first for obtaining a medication by use of fraud. And they put me on like pretrial intervention. I did 6 months of drug testing classes, which I needed. That was great. And I got done with that. And I'm like, all right, like life is going to start again. I had been sober since the day that I stopped, or since the day that I was caught. And at that point, within the week of the state dropping their charges, the feds arrested me. And I was sentenced to 9 months of house arrest. And I'm a felon now, convicted felon. And I deserve that. I mean, I know that I deserve it. And I think had this gone on longer, like I said, especially if a patient had been harmed or received one of those saline vials or sat in pain, I would be sitting in prison for a while. I think I am so lucky. I'm so thankful that I was caught when I was, before it really got out of control. I feel like I'm talking here.
No. Thank you for sharing all of that. Do you think that God intervened and made sure no patients got any of those saline put in their IV?
I feel like divine intervention, something. Because, I can sit here and say that never would have happened. I knew to take them when I was fired. I never would have allowed that. But the fact that I did it and I let them, them sit there, I think so. I think there's something. I am just so grateful that it never got to that point.
Yeah. What did your husband say when he had no idea you were using for those 4 months? You lose your job and then now you're under an investigation. Mm-hmm. When you bring this to him, and I'm assuming your in-laws found out as well because of the trip cancellation.
Yes.
What did they all say?
I mean, they were shocked, so supportive. My husband really, when I told him after I was fired, he had absolutely no idea. He kind of just sat there. He didn't even have like words to say. He was like, that's the last thing I was expecting you to tell me. He's like, I don't even know what to say. He was very supportive though, just completely. Same with my dad, same with my in-laws. I hid it like very well. And my husband has been supportive throughout the whole thing, but I don't know if it really, just because it was a shorter period of time, my husband, it took him a while to really understand how deep in I was. And he gets it now, but it was just complete shock. And
when was your last use? When did you take from a vial last and shoot up?
It was before I forged that document, when I started to panic. So I'd say October, mid-October of 2022.
Okay.
So 2 years. And then as far as I did start drinking a couple months, it was after my first arrest. I hit this really, really like the lowest place that I had been, and I had been low before, but this one, when I realized, I had done this to my family and I could be facing prison time. I had a lot of like mental issues with just myself. I'm like, what kind of, psychopath does what I did? I have 2 daughters, and I thought maybe I had a personality disorder for a while. Like I had a lot of issues. Just why did I do this? How did I allow myself to, do this to my family, to my kids? And I've, since I've gotten therapy, and I'm in therapy every week, and I'll be in therapy for the rest of my life. But the blame was something that was so hard for me to handle.
The shame and the guilt.
Yeah.
But you want to know what? No one got hurt. Thank God.
Mm-hmm.
No one got hurt.
And they would have eventually. So that's one thing I just want to make sure I really harp on. It's that just because I say that, no patient was affected, no patient sat there in pain, it was like well on its way to happening.
Yeah.
I mean,
well, from an accountability standpoint, you are here on my show talking about it. So you are taking full accountability. That's not, I'm just saying, thank God nobody got hurt.
Yeah,
and that's why I was asking the question. No. That's why I was asking the question before, do you think it was like a higher power moment, where, God made sure nobody got hurt.
I think so.
Because imagine dealing with that, guilt and, it would have been tough. But so now you are doing fentanyl, that comes to a very hard stop.
Yeah.
Then you go through the drinking pattern. Mm-hmm. When do you pull yourself out of the drinking, and what do you do? You said therapy. What are some other solutions that you have implemented in your life? I know for a fact that you help others, and helping others is huge. So what are some tools? What are some tools that you've implemented?
As far as, because I have a lot of anxiety. I mean, I lean on people a lot more. I don't keep everything inside anymore. If I need a break from my children for a little bit, I'm such a people pleaser. I'm deep down, to my core, I am a very insecure people pleaser.
Same.
I mean, it's bad. Yeah. And so working on boundaries, I've learned that I am allowed to have boundaries that I stick to. I don't need to do everything for other people, and I'm able to do what I need to do for my own mental health. I say no to social endeavors if I need to. And my husband also, he's working on that too. And it's not that he's necessarily a people pleaser, but saying no to just anything that we feel like could be a potential situation, like drinking, going out with people, things like that. It's like we're not letting people down by having boundaries to keep ourselves healthy. Mm-hmm. So that's something that took a while for me to really learn to be able to do. People aren't going to not like you if you don't, if you don't do everything they want you to. So
for sure.
Yeah.
Insecurity, I would people please constantly, and I still do sometimes, because I do have insecurities just like yourself. And that is common amongst people who struggle with addiction. It's very common. Setting boundaries is I don't want to let that person down. Well, at the end of the day, you need to take care of yourself, because that's what matters the most. Mm-hmm. And setting boundaries is so important. And I feel like people don't, they look past setting boundaries and don't realize the importance and how detrimental it potentially could be to your own well-being if you're not setting boundaries.
And one other thing I was thinking about, because I'm curious with you too, when I did start speaking out and talking about this, I remember it wasn't just one thing that one time, it was several times I had this thought where, while on house arrest, I'm like, okay, I could just keep this inside, never talk about it, never, never get out there and try to help people and just, move past it completely. Just never think about it. And I'm like, or I can try to give back and do what I can to prevent anyone else from going down this path. And you just said that, that helps. But I think that's the number one thing for me. I could be wrong, but I feel like just getting out there instead of keeping it within myself, and just the turmoil that I felt within myself of, I did this. And if I don't share it, I'm just going to keep this inside me. It's a part of me that I feel like I don't want to hide it. And I think that would have not made me use again necessarily, but it could have, because it's been really, really helpful for my mental health to just get out and like talk about it. And that's why I love your podcast so much.
Thank you. But that's the biggest difference between yourself and someone who's a chronic relapser. Someone who's a chronic relapser
Really? Okay.
doesn't. Yeah, no, that's common. Like people who constantly relapse. So I go to a 12-step program, and in the 12th step, 12 step is helping others. You can't keep what you have unless you don't give it away. So I said that wrong. You keep what you have by giving it away. Sorry. And right now you're at this point where you've accepted and taken accountability, and you are keeping that acceptance and accountability by going out to different facilities and, places, of your old profession and helping others. And that's initially where I ran into you. Well, we connected was you sharing your story and helping other people.
So many people commented and tagged you, and I'm like, okay, I guess I need to see who this guy is.
No, but
I love what you do.
You know that. I appreciate that.